It's National Infant Immunization Week, and it's a reminder to parents about how important it is to stay on track and make sure your children are up to date on the recommended childhood vaccines. It helps to keep them safe from preventable diseases like whooping cough and measles. Children routinely receive vaccines that protect them against 14 diseases in the first 2 years of life. Joining us now to talk about this is Kathy Kudish, the Immunization Program Manager from the Department of Public Health. Kathy, thank you so much for being with us.
Thank you for having me.
So the pandemic really was a disruptor to so many of us, adults included, where we did not go to our annual checks as normal. This also impacted many families. I have to imagine we're seeing a lot of children who are behind or even missing vaccines right now.
That is a concern. Nationally, we're seeing some reports showing that the COVID-19 pandemic has negatively impacted our childhood immunization rates. And these are routine vaccines that are given to every child on a certain schedule at a specific age. While we can't truly quantify the impact of the pandemic on vaccination rates on Connecticut children yet, we do have some early indication that when all of that data is collected and analyzed, we will see that fewer children were vaccinated on time during the pandemic. It's important to be vaccinated on time so that we don't leave children vulnerable to preventable diseases. And when they're behind schedule, they should be caught up as soon as possible to limit that extra time that they're susceptible. But there is some good news, and that's that in Connecticut, we're also seeing indications that although children may be late, they are being caught up by their pediatricians and primary care providers.
I was just going to ask you about that because for people who are watching right now saying, oh no, I didn't hit those specific milestones when my child should have gotten the vaccine, can these families still get back on track?
Absolutely. So the best thing that parents can do is to reach out to their child's primary care provider or pediatrician to ask if their child is due for any vaccines or a wellness visit. And routine immunizations, along with other important preventive care, is delivered during wellness visits. Children can be placed on a catch-up schedule if one or more vaccines in a series are due, and additional vaccine appointments can be scheduled until their child is caught up. And if parents don't have a primary care provider for their child, now's the time to get one. And we at the Department of Public Health can help parents find a primary care provider if they need it. Parents can call us at 860-509-7929 for assistance.
Okay, and we will make sure to get that information on the app as well. I know with my two little girls, it was a very strict schedule that we had to follow and making sure that they got these vaccines at certain times and certain ages and certain distance between them. For people watching who maybe are not a fan of vaccines, or I know that has been a very polarizing topic with COVID, what can you stress to parents out there how important it is to get your child vaccinated?
Yeah, well, I know it's hard to listen to somebody you don't know. You don't know me. We don't have a relationship. It's important that parents trust their primary care provider and that they have one for their child and that they discuss their concerns for their specific child with their doctor. And their doctor can guide them on the best thing for their child.
Good advice. It's also National Infant Immunization Week. We mentioned that earlier. Are there any events happening this week to commemorate that and mark that?
There are. So at DPH, we fund staff that are located at local health departments, and they plan activities locally for National Infant Immunization Week. And this includes some free materials that are being distributed at several birthing hospitals, libraries, consignment shops, WIC offices, and local health departments. And so there's some specific details with contacts for these activities that were in our press release. The Department of Public Health put out a press release on NIIW yesterday. It can be found there, and I can also share it with you all.
All right, well, that sounds good. I think it's a good topic to remind people about. And the bottom line is that if you haven't kept up with these vaccines, there is still time. Kathy Kudish from the Department of Public Health, we really appreciate you being with us this afternoon. Thank you.
Thank you.